Hey everybody, it's Matt Shu from Upright Health. In this video, we're going to talk about 3 things you must read if you have been told you have hip impingement. If you've been told you have hip impingement, you're probably worried about the shapes of your bones causing your hip pain. What you should know is that this theory didn't even exist until 2001, and it's only in recent years that studies have been looking at this theory and the overall surgical treatments. In the last few years, we've seen studies being published that actually call into question this controversial diagnosis. And I'm going to share with you a couple articles that you should read that give you a different perspective on the entire hip impingement conversation. All 3 of these articles are written by medical professionals, and I'm going to leave links in the description so you can go read these for yourself. The first article to check out is called FAI, Fact, Fiction, or Fantasy. It's written by radiologist David Rubin. In that article, he talks about how X-rays and MRIs are used to justify surgery even though there's not really strong evidence to interpret the X-rays and MRIs the way surgeons do. For example, when looking at an MRI, if you see signs of hip impingement and you see a labral tear, a lot of times you'll be told that it's the FAI bone shapes that are causing the labral tear, when in fact there is no evidence that has established that relationship at all. This article goes in depth into a lot of other myths around FAI, so it's definitely worth your read. The second thing to read is a blog post by the Sports Surgery Clinic in Dublin, Ireland. Now, in their post about the growth of hip surgery in Ireland, they talk about how hip impingement surgery is not really based on good evidence. And they also talk about parallels in the history of orthopedic surgery. So they look really specifically at knee meniscus surgery and talk about how knee meniscus surgery became really popular with only very limited evidence. And only after many, many years did they finally have high-quality studies that showed that meniscus tear surgery was actually often no better than a placebo, like a fake surgery. Now, what's really important to note is that in the beginning days of knee meniscus surgeries, they were really aggressive and actually only later discovered that the aggressive approach that they took to removing menisci actually led to more joint damage in the future. The third thing to read is an article by physiotherapist Michael Ryman. In his article, FAI surgery is on the rise, what is the next step? He looks at some really problematic issues with the way the medical system looks at hip impingement and hip pain in general. One of the major things he points out is that patients are often led to believe that MRIs and X-rays definitively identify the cause and source of their pain. That was never true for back pain, was not true for shoulder pain, was not true for knee pain, and it's apparently still a completely unproven idea for hip pain. So he looks at that and many other issues and summarizes all the many things going on with physical therapy and in the orthopedic surgery environment. So it's definitely worth your time to read that. It's the most recent article of the ones I mentioned in this video, so please check that one out. The main takeaway with all 3 of these pieces is that the current medical approach to hip impingement isn't based on strong evidence. And when we look at other examples of surgeries that have been done for joint problems, we can see a really familiar pattern. With shoulder impingement, with back pain, with knee pain, really aggressive surgeries used to be the order of the day. After a few decades of research, they discovered that those surgeries were actually no better than placebo and often carried much, much higher risk of failure and a need for more surgery. One final 4th thing you should read is a study that looked at whether or not patients' expectations were met when they underwent hip impingement surgery. What they found was for these patients who were looking for pain relief, more than half of them did not have their expectations met. A study like that starts to paint a picture that looks very familiar when compared to back pain, shoulder pain, and knee pain surgeries in the past. Alright guys, that's going to do it for this video. Be sure to check the description section for links to all the articles I mentioned in this video. You'll also find a link to the FAI Fix, which is an online do-it-yourself training program to help you get your hip muscles to work well. Once you get your hip muscles working properly, your hips stop hurting, your hips feel good, and you live your life the way you should. If you liked this video, be sure to click the like button down there, as well as the subscribe button so you don't miss out on any other videos. You can also find us on Facebook. There's a link in the description section. And if you want to help support research like this and videos like this, check us out on Patreon and make a pledge of $1, $5, or $10 a month so that we can continue to make great videos to help you live your best life. As always, I hope you remember that pain sucks. Life shouldn't.